We'll now transition to market access and how to best achieve, of course, a successful outcome and one. And here to share their views is Jessica Lundström, your Director, Market Access at Bristol-Myers Squibb. Welcome. And Jonas Fredriksson, Senior Advisor and Consultant with experience from Sobi and Novartis.
Thank you.
Fredrik Olsson, next to me, your CEO at Genovis.
Thank you.
And John Strobel, Managing Partner at LamaMed Access. So you'll have to share the mics between you, but I would like us to start with a short round of this question. What is the hardest decision to make when you're about to expand to new markets?
Should I go first? Yeah. I think one of the hardest decisions is to pick the right market, to really prioritize. And maybe the hardest thing is to decide not to launch, but prioritize the market, and choosing the right is, I think, one of the biggest challenge.
What do you say, John?
I'd say also kind of having a personal talk with yourself and know exactly what you're really ready for. You know, look at your internal resources and then really plan it out, and don't try to bite off too much at once. Focus, go deep, and then you can expand as you're ready.
Jessica, you're up.
Yeah, I'm on the same page as you mentioning prioritizing. I work specifically in market access, and I mean the access environment is challenging, and some markets are really unpredictable and difficult to understand. So I'd go for somewhere predictable, where at least can foresee the outcome, and somewhere depending on the product, of course, where you can. Where they're incentivizing innovation, you can get a lot of value out of it.
Yeah, I think I would say that you do a lot of it's a heavy investment when you make that decision, and obviously I think it's important to make the decision. There will always be unknowns, and you would have to solve them, on the way, I would say.
Thank you. John, if you allow us Scandinavians to be a little bit self-absorbed, because it's at least us in the majority of the audience, what do you feel like is the one thing Nordic companies need help with to access the US market?
Okay. I wish there was only one thing, then we just go home now. But I think, first, obviously regulatory, that's kind of your price of entry. But then I think there are really three core things. One is product market fit. And this is something you're going to kind of do kind of holistically at the same time. So market fit, make sure you really talk to KOLs, people in the market, potential customers. And the next thing would really be look at reimbursement. Can you get paid? And then the last is a really efficient channel to market.
Do you feel like those are more of a typical challenges for us in the Nordics?
I think they should be typical challenges. At least we really look into those in detail. From personal experience, LamaMed Access, we actually have either started or operated 20 plus companies. Okay, and so over time we kind of struggled with a lot of those, and those are things I've seen not only in the U.S. but 50 plus countries I've got into. So I think it's kind of a recurring theme, but over time you kind of learn from those mistakes, and you build up an infrastructure, and it gets easier. In fact, we got to the point now, we're actually kind of doing those services for other people to kind of help them navigate. And it's something I think anybody can do. I know you've done that with your company, set up U.S. operations. But I think it's just a matter of resources. If you have the resources, you can do it. But if you have a local partner, then you can actually work with them and kind of get through those mistakes, hopefully get rid of a lot of headaches along the way as well.
Jessica, we'll dive right into market access. Which factors do you need to consider negotiating the right price or value for your product?
Yeah, that's a really tricky one, and I think it also relates to what the panel before here, how the clinical trial is set up. The willingness to pay is quite different in different countries, and ability to pay, of course, but also the systems for having incentives for innovative products, and also if you're a cost effectiveness market with HTA assessments. So all those factors play a big role, and then that depends on what kind of trial have you made? What kind of evidence do you have in your trial to support entrance in a cost-effectiveness market, for instance? You also need to consider if the markets are have like automatic or like systems for regular renegotiations, so you need to lower your price along the way. And we also have the international reference pricing systems. So for an example, Sweden is a small country, but our list price is impacting a lot of other countries. So entering in Sweden with a rather low price will have a big impact on big markets like Germany, Switzerland, Spain, and so on. So, I mean, it might be difficult to foresee. Sweden has a rather high willingness to pay, I'd say, but no special incentives for innovation. But then you have other markets where it's quite the opposite. So you need to do the mapping first to be able to know where you can get the most value out of it and what you need to get out of course, depending on cost of goods and development costs.
I mean, it is what you say, but how is it more important to get the right price rather than the best price?
Yes, for sure. I mean, I come from big pharma. We generally want to have like a high price and premium price to come with great innovations, of course. But I have examples where we, from a market perspective, had to go for lower price to get into the market, which proved to be a huge success. So yes, I mean, you need to look at the market, and sometimes the highest price is not the best price.
So Fredrik, you are our example here today as CEO at Genovis, a company that actually made it. What would you see are your key decisions that you made succeeding, actually growing a small business into, selling one of the to the biggest companies over the world?
I would say that a key decision for us was actually to build our own sales force very early on, even though we were not really advised on doing that. I think the key decision have also sort of fueled the development of the company going forward, because we could reach the customers, which was the key item for us, and then help that to further fuel our innovation going forward. So I think that was a key decision. And when you're a small organization, it's also important in terms of who we have talked about prioritizing certain markets. So we went for US very early on, obviously for various reasons, but also the individuals that you actually connect to and bring on board early stage is very, very important. And I think that we have learned a lot. The whole company have learned a lot from those early individuals that help us access the market through our own sales and marketing organization very early on.
But do you feel like you had something unique that you thought of or did to make this hard journey?
No, I mean it's hard work, but I think the important thing is not wasting too much time on unimportant stuff, but rather get in front of the customer. And try to build the customer base and get that going, because that fuels a lot of other stuff and keep you in the right direction.
Please feel free if you have comments on each other. But I also would like to ask you, Jonas, because I know you work with this a lot. Like, broad question, but what considerations should you really consider before expanding into new markets?
So I think before you will expand to a new market, it's crucial that you make sure that you have the right information so you can do the right decision of if you should enter the new market and also which one you should prioritize. Of course, you need to look into everything starts from the unmet medical need, and you look into the competitive landscape and number of eligible patients. You need sales potential, revenue, return of investment, and things like that. But also, you need to really analyze the healthcare infrastructure in the country. You need to look into the regular framework? And which local authorities do you need to approach? And how does the procedure look like? What's the timelines? What's the cost for it? Do you need any local clinical trials in that country, or do you need to have manufacturing in the country? So it's a lot of things there you need to understand. Also, if there is pharmacovigilance obligations, legal and compliance consideration. But then one thing is to get this regulatory approval, but then it starts also with the pricing and reimbursement here also. What's the timeline? It differs a lot from different countries. And I think also what is important here, you need to have local market knowledge and expertise. And here, should you go, do you have that in-house, or do you need to have good partners here to do that? So it's a lot of different things. And then after that, it's supply and logistics. And when that's ready, it starts to plan for the launch. And then should you go with a local distributor, or will you build up an in-house organization, as Fredrik talked about? So I think it's a very complex situation or process, and you should not underestimate it, because you need this information in order to do a really good decision.
This is a question for everyone, and see who feels up to it. But we heard yesterday and today a lot, like, there's a lot you have to do. You have to have all the information you need. You have to make the right decisions. You have to think about all the decisions you have to make. You have to plan ahead, while at the same time be very open to flexibility and being agile. Do you have any concrete advice for people who do this? Like, how do you do that well? John?
Yeah, I really think jump in, but just make sure it doesn't kill you. That's the main thing. Go in, try it, dig deep, work out the bugs, maybe in a local market or a region. Don't like jump into the US or jump into Europe into 20 countries. But work out the bugs, stay close to your market, get the feedback, refine it, and then you'll feel more comfortable, and hopefully even get revenue, profits, and then expand gradually as you see fit.
Any other thoughts?
Yeah, I think we discussed collaborations, and I think, leverage all the connections you have. I think there are a lot of great like trade associations, chambers of commerce. We have that many different in Sweden. They exist in many countries. They are often interested in helping you, so take all the help you can get.
Yeah, that's a very concrete advice. Ask for help or pay for help. If I should, conclude. Anything else? What do you think, Fredrik?
No, I would like to agree with Jessica. I think that preferably we would have our own people in the local market, because that's a great learning. So that has been our approach ever since. That if we can get a local product specialist or representative in a country, we would prefer to do that rather than having them here in Sweden. Because that brings a wealth of knowledge about the market and those subtle nuances. We think we are culturally very, there are cultural differences, which I think is important, and you will get that at the same time. But then I think in certain markets, I think we have Business Sweden, which is quite unique, and they could help you a lot about, when it comes to regulatory and things like that, fairly efficiently in our experience.
Can you mention some of them you're thinking about specifically? I mean,
for example, when we went into China, that was obviously a challenge. But if you don't want to set up your own operation and things like that, having Business Sweden, all about recruitment, taxes, pensions, how things work in that particular local market. Those types of things, you can have that advice, and I think that's very helpful.
Jessica, did you want to?
Yeah, I was thinking of the same thing actually, but one more thing, we were discussing learnings as well. Document your learnings. I think we all know that we make a lot of mistakes, and sometimes the mistakes are the best ones, because then you don't do them again and you do things the right way the next time. So learn from mistakes as well.
I would also like to, go into, but no, actually, when we talk about mistakes, that's much more fun. Can you give me some examples that you come to think of? Yeah, John.
I think a lot of times people will go in and set up a distributor and just say, okay, it's done. So I think it's really important to find a partner you can really trust, and then also maintain control of your brand. So when you go in, keep that customer contact. Even if you have a local partner, work with them to talk to your customers so that feedback comes right back to your company instead of setting up a barrier.
Fredrik, you had a quite early wake-up call, you said, when we prepped a little bit in your company.
I mean, you tend to, sometimes you tend to sort of underestimate also, I think, what John is talking about when staying close to your customers, even if you have a distributor, try to bring that wall down. But also I think distribution is one of those things that it sounds simple, and then you find yourself in a situation where it could be immensely complex actually to actually ship products.
Did you find yourself in that particular situation?
Absolutely. We thought that we could ship everything from Sweden. You could drop ship it to our customers, the pharma companies in all over US, and it wouldn't be an issue. And it turned out to be actually super complex, and because of customs, clearance, and those types of questions, and customers were disappointed. They were waiting for the product, for 1.5 weeks for waiting for an enzyme, and that was not acceptable. So we clearly needed to find another way. So now we have our own warehousing and customer service and things like that in US, and then we ship next day delivery to our customers. So I mean, those types of learnings, underestimating the complexity of shipping, very delicate product enzymes in our case around the world. It's not simple. It takes experts to do that.
Yeah, and I think this with local market knowledge is so important. And if you don't have it, you try to find a reliable partner that can help you with that, because it's crucial to get the right decisions here.
Let's talk about market access again. How do you form a realistic idea about the market share that you can access? Jessica, this one is for you, I think.
Yeah, I think realistic is the key word here. And you need to be a bit self-critical, I think. But of course, it's the competitiveness. Are you first to market, second to market, third to market? That will, of course, have a huge impact. What kind of evidence do you have? Will you be able to get the position you want based on the evidence you have? How complex would it be to get market access? Can you achieve that? Can you achieve the value you want? I think you also need to think of, is it a very guideline-driven market? Is it promotion sensitive? And can you invest in a sales force? So I think depending on what kind of product you have and the resources you have, all those aspects will have a huge impact. But I've been in a situation both where we hugely underestimated the potential of the brand, where we have one of the world leading brands actually, which is super cool, which was not expected at an early stage, but of course also the opposite, where you thought this would be simple and then was not so easy.
No, but also when you estimate your market share here, I think you need to go back and look into the patient flow also. How many patients are there? Look into how many are eligible, the competitive situation, and which patient segment you will really focus on. And then you need to do an estimation. How big share can I get for here?
I feel like still we need to go back to distribution and logistics that you were in on. I feel like we could dig a little deeper there. What are the pitfalls one should be aware of if sitting somebody here in the audience and get scared now? Help them out with a parachute.
In terms of distribution?
Yeah.
Yeah. I think there can be a lot of what I call brand collectors. When you set up distributors, they just want to take your brand on, and they may just kind of put it in a big bag with a lot of other products. So you really need to make sure there's a personal fit. Sometimes there may be a small local distributor that's actually going to give you more time than a large national distributor. So you really need to make sure they are in line with your values, that they can really spend the time in product, education of the product to really go forward and do what you need to do.
Do you have any more hard lessons?
Yeah, I think we needed to sort of reformulate our products, which at the time we didn't realize was actually innovative. But most of these reagents are traditionally was shipped using dry ice, for example, in big styrofoam boxes, and that proved to be very expensive and even more complex. So. We didn't know anything about lyophilizing enzymes, but we sort of developed that part of it, and now we could sort of ship the enzymes in ambient. So I think temperature. So I think those kind of things, if you can bring also innovation to other stuff beyond the product and be a little bit more unique, that's also a way to become more competitive.
Do you agree with that, John?
Yeah, I'd agree. Because you look at the logistics, but you also, once you sell something, it's not over. You have the post-sale service and all the other things around it. I think a lot of companies kind of forget about. They think we sell it, great, we're done, we have revenue, we walk away. That's just the start.
I think you all made the point how important partners or collaborations are, especially locally. Would you say which ones are really crucial in order to access a new market? In which sort of areas?
I think what's crucial here is coming back to, I think in the beginning, that regulatory framework. When you work on that, you need to know that, and there I think it's super important to have a good partner. But then also when it comes to market access and reimbursement pricing, there you need to have local knowledge here also, and a partner there also. And then of course also when you go into marketing and sales, if you don't decide to do it with your own organization. It could be different partners, but it could also be the same partner here also. It depends on the market.
I mean, for many, it is a goal to have a partner. Maybe they don't. Do you have any advice on how to keep up on the fast-changing regulatory framework?
I've always just hired someone that really knows regulatory in the market. There's a lot of, like in the US, there's a lot of ex-FDA people you can hire, consultants and things like that, because that way they know it. I'm not a regulatory expert, but I know a lot of them that I can call.
Let's go on then. Risk assessments. We're quite risk averse, the norther you get. I don't know if that's just en fördom. But what are the biggest risks that you do face when expanding to new and, let's say, unknown markets?
I think it's what we said in the beginning, that you underestimate the complexity in the process. I think that's very easy to do. You're optimistic, ambitious, you would like to reach as many markets as possible, but you need to really prioritize which are the most important for you.
I'm also on the underestimation piece and the time needed to succeed. I think I've been in, well, maybe not the same situations as you, expanding to new markets, but in very complex projects. You really need to look at what's the value of this investment, this expansion. Also, if I get delays, what's the area under the curve? What will be the value if I get a 1-year delay? And build that into the risk assessment, I think is very important, because I've done fantastic, complex, huge projects, and then they were so much delayed that the value was almost zero, unfortunately.
Can you tell us a little bit more about that?
Yeah, it's also related. I mean, it was around. It's a project in Sweden. I can't tell all the details because it's not published yet. But around finding a model to find the undiagnosed patients within that area. but it was very complex also from an internal perspective because it was quite creative and innovative, meaning that the approvals took so long and then the external approvals took so long. So now we're at a too late stage in the product life cycle, so the value will be quite small, opposing they could have been huge.
Fredrik, what are your views on which risks, are you going to face?
Well, I think early on when you take on a project and you decide to go into a certain market, you tend to, going back to Jessica and timeline, I mean, it's more a rule that it takes longer than you actually anticipate before you're there. And then I think also one of the things is making sure you understand your value proposition of the service or the product, and then coming back again to actually try to have those key opinion leaders or customers that you hopefully have, and use them to actually make sure what you're actually trying to achieve here provide the value that you expect.
I think we'll have time for some questions. Let me just take some eye contact with you, Mike. Is there coffee up after this? Okay, good. So we know if you don't have any questions, we'll mingle a little bit instead. But do we have any questions from the audience? You could also please just raise your hand and we'll give the mic to you. Everyone is up for coffee. No, but seriously. Yeah? Do we have anything on the...
We do, yes. When is the right time to start building my market access story, and do I need to include this in my trials?
Jessica.
Yes. Yeah, very, very early from the start. I mean, we've been, in the company I work in Bristol-Myers Squibb, we've been buying assets. And unfortunately, a couple of years back, we bought assets where the access requirements wasn't not built into the trials. And we have products that are great and the clinicians want them, but we can't get them through the system because we don't have the data needed for market access. So yes, it's super important to, and also to, I mean, to the discussion in the panel before us here, it doesn't have to be much more costly to include it in the trial. There are like quality of life parameters, thinking of when to end treatment. That's usually, if you look in the cost effectiveness market, that's usually really driving the costs if you don't know when to stop treating. That's super important. And those parameters can actually make the whole difference. So start with the end in mind was mentioned before. I really want to emphasize that from a market access perspective as well.
Well, all remember that. I think it would take one thing away. Yes, please.
Also comment here, in some countries require local clinical trials also to get an approval, and it's important to notice that. So it's important to have that in mind also when you're planning for it.
Mike, do we have any other questions?
Not at the moment, no.
Not at the moment. Well, I have one before. I'll promise you a coffee and maybe even get something to eat. With limited resources, because of course we want to pay everyone who are experts, we would like to have deals, but I mean, we also have, and a lot of companies face limited resources. Which costs are unavoidable, you understand, oundvikliga, that you really should prioritize? Everyone gets to answer. John.
Well, obviously regulatory, because you have to do that just to get in the market. But I think also is really maintaining your brand identity, because that is the core of your company. And so if you can maintain that, it doesn't cost a lot, and then also just focus and do incremental steps. So it may not have answered the question directly, but really go baby steps, go deep, and then expand.
Yeah, so put your money at least in the label, in the brand.
Well, in the brand, yeah, and make sure you have a good image going out of it, and you work out the bugs, because that's going to allow you to scale faster and also more efficiently later on.
Fredrik, what do you think?
Beyond the obvious, in our case, would be to make sure that we have freedom to operate. That would be that you need to have. Otherwise, I would say that, again, if you can get in front of some key customers, key opinion leaders, and really do interviews with them, our experience is that gives a lot of information also on the competitive landscape. You will have an easier way to assess the market. Someone said once that spend a day with a customer is worth more than 1 month of watching competitors or 1 year of reading market reports, and I find that quite true, actually.
Jonas, what should you spend your money on if you don't have so much of them?
No, I think it's important to really, as I said in the beginning, is to get the market knowledge. You need to know the market, and here you need to spend effort, investment to do that before you take the decision. You need to have that, and then of course also you need also to invest in the regular process and get the cost for get approvals. That needs to be there also.
Jessica.
Yeah, and don't forget market access. No, but of course, I think, regulatory, of course, is super important. If I look at when we prepare very early, the combination of medical, really engaging, as you say, engaging early with opinion leaders and understanding the market, as well as preparing for market access is, you need to have that. But agree on the positioning. I think in smaller companies, of course, you can combine medical and commercial competencies in one, but having that cross-functional approach early but small scale is super important.
Will you all be available over coffee if we want to pick your brain about anything else? Yes.
Of course.
Yes, you can't say no after that. Thank you so much, Jessica Lundström, Jonas Fredriksson, Fredrik Olsson, and John Strobel.